Journey into silence. Understanding the coma state. Imagine a deep sleep so profound that the outside world fades away. This is the realm of the coma, a state of prolonged unconsciousness, where a person appears unresponsive to their surroundings. Unlike sleep, a person in a coma cannot be awakened, their eyes remain closed, and they show no signs of awareness. They are adrift in a sea of silence, unable to communicate or respond to external stimuli. The human brain, a complex network of billions of neurons, orchestrates our thoughts, movements, and senses. A coma disrupts this intricate symphony, plunging the brain into a state of profound inactivity. It's like a sudden power outage, leaving the brain circuits dark and unresponsive. Coma is a serious medical condition, often a result of significant brain injury or dysfunction. It's a stark reminder of the delicate balance within our brains and the profound impact that disruptions can have on our consciousness. Understanding coma, its causes, and its effects is crucial for developing effective treatments and providing hope for those lost in its depths. Awakenings, causes, and types of comas. Coma's silence can be triggered by a variety of factors, each disrupting the brain's delicate equilibrium. Broadly, comas are classified into two main categories: induced comas and traumatic comas. Induced comas are medically initiated states of unconsciousness, often employed as a life-saving measure. In situations like severe brain swelling or intractable seizures, doctors may induce coma to protect the brain from further damage. By temporarily silencing brain activity, they aim to control the underlying condition and allow the brain time to heal. Traumatic comas, on the other hand, are the result of sudden and severe injury to the brain. These injuries can be caused by a blow to the head, a stroke, or a lack of oxygen to the brain. The force of the trauma disrupts the brain's normal functioning, leading to a loss of consciousness. The brain in hibernation. Neurological effects of coma. To understand the neurological effects of coma, picture a bustling city plunged into darkness. The brain, normally a hive of electrical and chemical activity, becomes eerily quiet. Communication between brain cells is disrupted, leading to a profound loss of function. During a coma, the brain's metabolism slows down significantly. This metabolic suppression is thought to be a protective mechanism, conserving energy and reducing the brain's demand for oxygen. However, prolonged metabolic suppression can also be detrimental, leading to cell death and permanent brain damage. Different areas of the brain are affected to varying degrees during a coma. The cerebral cortex, responsible for higher-level thinking and consciousness, is particularly vulnerable. Damage to this area can result in profound cognitive impairments, even if the person eventually regains consciousness. Section 4. Stages of silence. Navigating the depths of coma. Coma is not a one-size-fits-all condition. Its severity can vary widely, ranging from a light stupor to a deep unresponsive state. Doctors use a variety of scales, such as the Glasgow Coma Scale, to assess the depth of coma and track a patient's progress. At one end of the spectrum is a minimally conscious state, where a person may exhibit fleeting signs of awareness, such as tracking movement with their eyes or responding to simple commands. This suggests that some level of brain activity is preserved, offering a glimmer of hope for recovery. Deeper comas, however, are characterized by a complete absence of awareness and responsiveness. Patients in this state may require life support to maintain their breathing and heart function. The longer a person remains in a deep coma, the greater the risk of irreversible brain damage and a poor prognosis for recovery. Section 5. Whispers of Hope. Treatments and medical interventions. Treating coma patients is a delicate balancing act, requiring a multidisciplinary approach to address both the underlying cause and the coma's effects. The primary focus is on stabilizing the patient's condition and ensuring their survival. If the coma is induced, doctors carefully adjust medications to gradually wean the patient off sedation as the underlying condition improves. For traumatic comas, treatment often involves surgery to relieve pressure on the brain, manage bleeding, and remove any foreign objects. Supportive care is crucial for all coma patients. This includes providing adequate nutrition and hydration, preventing bed sores, and maintaining a clean and stimulating environment. Sensory stimulation, such as playing familiar music or speaking to the patient, may also be beneficial, although its effectiveness is still being studied. Section 6. The long road back: rehabilitation and recovery from coma. Emerging from a coma is often just the first step in a long and arduous journey of recovery. The brain, like a muscle, needs to be retrained and rehabilitated after a period of inactivity. Rehabilitation for coma patients is highly individualized and may involve a combination of physical, occupational, and speech therapy. Physical therapists help patients regain strength, coordination, and mobility. Occupational therapists focus on improving daily living skills, such as dressing, eating, and bathing. Speech therapists work with patients on communication, swallowing, and cognitive skills. The road to recovery from coma can be long and uncertain, with progress often measured in small steps. Some patients may make remarkable recoveries, regaining most of their previous abilities. Section 7. Mysteries remain: long-term outcomes and the enigma of consciousness. Despite advances in medical science, coma remains a perplexing and often unpredictable condition. Predicting long-term outcomes is challenging, as recovery can vary greatly depending on the severity of the brain injury, the duration of the coma, and individual patient factors. While some individuals make remarkable recoveries, others may experience lasting cognitive impairments, affecting their memory, attention, and executive function. Physical disabilities, such as paralysis or difficulty with speech, are also common. Perhaps the most profound mystery surrounding coma is the question of consciousness. What happens to our sense of self, our thoughts, and our experiences when we are in this state of profound unconsciousness? While we can observe the brain's activity, or lack thereof, during coma, the subjective experience of being in a coma remains elusive. If you found this video insightful, please like, comment, and subscribe for more content on fascinating medical topics.